Doctors today routinely diagnose and treat a myriad of illnesses and diseases suffered by society's littlest patients, unborn babies and newborns, significantly enhancing both the children's health and longevity. Abortionists, on the other hand, take a different approach. They dismember and chemically kill unborn children for profit. And for decades, babies have survived later-term abortions. As far back as 37 years ago, a Philadelphia Inquirer story called Baby Survival the Dreaded Complication. Dr. Willard Cates of the Centers for Disease Control was quoted as saying, "Live births are little known because organized medicine, from fear of public clamor and legal action, treats them more as an embarrassment to be hushed up than a problem to be solved. It's like turning yourself into the IRS," Dr. Cates goes on, "for an audit. What is there to gain? The tendency is not to report because there are only negative incentives." Of course, the tendency is not to report. When an undercover investigator asked an abortion provider from Planned Parenthood about the procedure for checking for signs of life in a baby born after an attempted abortion, the abortionist responded by saying, quote, "I mean, the key is you need to pay attention to who's in the room." Philadelphia abortionist Kermit Gosnell had a lot of people in the room, but nobody was reporting, as he killed and snipped the spinal cords of hundreds of born babies to ensure that they didn't survive. You know, all is not well in the abortion clinics either in terms of their own personnel. The National Public Radio, NPR, did an incisive story featuring former Planned Parenthood director Abby Hoffman, Johnson, who's now pro-life, and her outreach to clinic workers encouraged them to quit their jobs inside the abortion clinics. Heard on All Things Considered, Annette Lancaster, a former manager of Planned Parenthood in North Carolina, said her abortion work made her feel dark and morbid. Annette said she was troubled by the way she and some of the other workers referred to fetal remains. She said, "I just started being able to use my deep freezer in my home by going through therapy because we used to call the freezer the nursery," that is to say, for the dead babies. The National Abortion Federation, in their textbook for abortionists, say providers should consider the possibility of a live-born fetus, particularly if fetal death is not induced prior to the procedure at the gestational age of 18 to 20 weeks or more. Besides the emotional and ethical difficulties for patients, their partners, and staff, a delivery with signs of life may have legal implications. The problem with existing law, Mr. Speaker, is enforcement, the lack of legal implications. Marsha Blackburn's bill, the Born Alive Abortion Survivors Protection Act, requires, under penalty of law, that healthcare professionals
Gentleman's time has expired.
I'll yield an additional 30 seconds, Mr. Speaker.
The gentleman is recognized for an additional 30
requires
seconds.
appropriate health care to be given to any child who survives an attempted abortion. Not looking the other way, that has been done for decades, Gosnell probably being the most egregious example. And the law prescribes that any healthcare practitioner present at the time that a child is born shall exercise the same degree of professional skill, care, and diligence to preserve the life and health of the child as a reasonably diligent and conscientious healthcare practitioner would render to any other child born alive at the same gestational age. And then following that due diligence, ensuring that the child gets to a hospital for care.